everybody. My name is Kara Moncrief, and I am the Clinical Director for Viora, and I will be covering contraindications today for our most of our technologies. This first PowerPoint covers radiofrequency contraindications. However, most all of the technologies have the same contraindications, and if you guys do like Botox, any type of fillers, you probably notice that it's about the same contraindications for those as well. So it's, it's pretty straightforward across the board, right? FDA and overall medical boards have the same contraindications for these cosmetic treatments. However, there are a few individual ones that are added on for the IPL and for the NDIAC. So I will point those out after we get through this PowerPoint. I'll point out the ones that are in addition to light-based treatments. So IPL and NDIAC are going to have all of these contraindications plus a few more. All right, so we'll get started. So the first contraindication for radiofrequency and really any of the technologies that you're using is going to be a cardiac pacemaker, defibrillator, or other implanted electrical device. And the reason being is if we are putting radiofrequency into the tissue, IPL into the tissue, we know we are working with that EM spectrum, right? So the electromagnetic spectrum, when we put that type of energy into the body, it can create theirs to not work properly. So it's electromagnetic field that can disrupt the frequency of the electrical implanted device. So for example, a cardiac pacemaker works by regulating the heartbeat, and we do not want to interrupt this regulation, and that is a potential risk. So unfortunately, they wouldn't be able to have these type of treatments done. Maybe something like a peel or, an overall facial, things like that may be the best bet for them. History of hip replacement, hip or femur surgery, or other just metal in the body. It doesn't have to be the knee or the femur. It could be, they could have maybe a metal in their knee from a surgery, and they want to get radiofrequency on their lower face. That is okay. We just don't want to take the radiofrequency or the IPL, for example, right over the knee. And the reason being is we are doing bulk tissue heating, and when there is metal in the area, that metal can heat up and create potential harm to the surrounding tissue. So we don't want to do that. Now, if we look back at when radiofrequency first came out for cosmetic treatments, it was monopolar. Therefore, if they had a metal knee, they wouldn't be able to do lower face skin tightening because it was monopolar, one electrode and then a grounding pad. Whenever you're using a grounding pad, you have to be worried about the metal in the full body. So because we are using bipolar or multipolar, depending on the handpiece or the device that you have, we just don't want to take that heat right over the metal area. Also, I would be very careful with keeping that heat at a distance. So, if they're getting their back of their legs done and they have a metal knee, for example, you don't want to take the heat too low towards the knee. You want to keep it high up. So just be very cautious with that. Now, if they have metal in the mouth, let's say, they have braces, they have a metal filling, they have a metal implant, it doesn't mean that you can't treat them. It just means you need to give some protection. What's nice about the mouth is that we can insert something, so we can have a block. So if they are for some reason feeling it in their teeth, it's uncomfortable, you can put gauze, non-woven gauze, make it kind of thick, and just put it in the mouth. Put it either in the cheek area or in front of the teeth, depending on where you're treating and where they're feeling that heat, just to protect that area. A lot of times with the IPL, they'll feel it in their teeth, even if they don't have metal. If that's the case, you can do that gauze trick, or you can just have them use their tongue. So let's say they're feeling it in their teeth and you're trying to do the side of the face, they can just put their tongue like this and move it around. wherever you're treating. So that's always a nice quick trick, and sometimes easier than, like, getting all that gauze in there. So it just depends, I guess, on your patient and you and what you're wanting to do. Next one is history of cancer. So I know this is a big one for a lot of offices, but unfortunately with FDA regulations and I say FDA just because I live in the U.S., so it may be your regulatory board in your country that's not FDA, but another regulatory. So what I'm looking for, you guys know what I'm talking about, but the same thing. So it's going to be a contraindication from Viora, any history of cancer. Now, sometimes physicians, the medical director may still want to treat. A woman had breast cancer 10 years ago, she's in remission, and the medical director would want to treat for skin tightening. It's still a contraindication, so it's still a risk that you guys would be taking. So I highly recommend just always talking to their oncologist before you go in to do treatments, making sure that not only get like a written, I would get something in writing from their oncologist, just them clearing them for the treatments, but I would also have a phone conversation with their oncologist too, and the medical director calling the oncologist, just to make sure that you're really taking every precaution that you can if you are going to treat somebody with the history of cancer. If there was any type of risk that it could activate the cells, cancerous cells, that's where you're taking that risk. Now, we don't have enough data, we're not studying, does heat do this to cancerous cells? But it is going to be just an overall risk that you may take. So I always just say that, just contact their oncologist and get a written form from them as well. Oh, and also we're talking about here moles and skin cancer. Of course, you're going to have to be very careful with skin cancer. That's a big contraindication because we're in the skin. You're treating the skin. Now moles, that just reminded me, always avoid moles. Never pulse right over them with radiofrequency, with IPL, with NTYAG. Just avoid them, just as a precaution. There's a trick that you can use to take a white eyeliner pencil and wipe out the area, so you're blocking energy from going into it with an IPL or with an NTYAG because it's light-based treatments. Or if you don't want to take the time to do that, then just work around it and don't pulse right over it. Any skin disease in the treatment area that may be affected with high heat temperatures. So there's various skin diseases, right, that may be aggravated by high heat temperatures. So that is going to be a contraindication, and we give an example here. If someone has chronic eczema and they have a flare-up, we want to wait 6 weeks until that flare-up has cleared, has calmed down and then cleared, because we want to give the time for the skin cell turnover. But we just have to be very careful, because if they are aggravated by high heat temperatures, we can aggravate it again. So just be very careful with any type of various skin diseases that may be aggravated by high heat temperatures. And I would always talk to your medical director, making sure that the medical director is okay with you treating if somebody has something like this, if you're going to go off of the contraindication. Okay, so you guys know this is what I suffer from horribly, because you got to meet Harriet a couple weeks ago, my cold sore, and you guys know I name them just like we name hurricanes in the US. I name my cold sores because they usually are a hurricane on my face. They're usually so big. And I got my very first cold sore from an IPL treatment years and years ago. So I never suffered from cold sores previously, but that high heat temperature made it come out. And a lot of us just hold this overall virus within our bodies anyways. So it can easily come out later on in life with high heat temperatures. So someone like me, if I'm filling out the consent form and I note that I do suffer from cold sores, It doesn't mean that you can't treat me ever, because I do, but there's a risk there that there can be an outbreak. Additionally, shingles, that same, that virus that lives within a lot of our bodies, it can come out in the form of shingles on the body. So this has happened with high heat temperatures. Somebody has gotten shingles on their face, an outbreak of it. So if anybody suffers from these things, just make sure that you're prescribing an antiviral. So a popular antiviral here in the US for cold sore outbreaks, herpes outbreaks, is Valtrex. So we recommend that you take, typically this is the dosage, it's as if they were having a herpes outbreak. So it's 2 grams the day before and 2 grams the day of is the typical dosage, just to really help not create any herpes outbreaks. Now, if you did the treatment and then they tell you and they're like, oh, I forgot to put it on my consent form, you can always prescribe Valtrex that day. Okay, I'm gonna prescribe you Valtrex right away when they're leaving the office. Go and pick it up at the pharmacy and take it right then, because sometimes we can stop the outbreak if they take it really soon. So that can help a lot of times. They do the same thing with like injectables. If they're doing filler in the lips, let's say, a lot of times they'll have them just pick up their prescription when they're leaving the office, just to make sure to stop it. But if you know ahead of time, it's better for them to start ahead of time. Okay. Here's another thing that is holds true to my heart, just like my cold sores, is Accutane. A lot of you guys know I suffered from really bad acne growing up, cystic nodular acne. It wasn't fun. They tried everything on me, antibiotics, so on and so forth, birth control, things like that. Nothing worked. So I eventually needed to get on Accutane. So the reason why I had to get on Accutane is because my sebaceous glands were so overactive, and it was creating really oily conditions in my skin, and of course that led to breakouts. So Accutane does the opposite, where it shrinks the sebaceous glands. We don't have much sebum being produced at that point, so the skin becomes very thin, because sebum helps keep our skin healthy, right? It keeps it thick, it keeps it protected. Sebum is great, but when you're on a medication like this and you're stopping sebum production, that's when the skin becomes very thin, very fragile, very sensitive, extremely dry. So, I mean, I could scratch myself and bleed. So, of course, you're not going to want to put heat over skin that is like this. So, you're going to want to wait 6 months before you can treat again to really allow the skin to properly get to that point where the integrity of the skin is going to be able to take treatments like that. It mentions the liver. I would have to get my blood drawn every month just to make sure my kidneys and liver were functioning properly. And it's a harsh drug, so you got to be very careful with that. And some dermatologists prescribe very small amounts of Accutane to older clientele, because it helps shrink the pore size. It makes the skin look better. So you just got to be careful with that, making sure that they're not on even a small dosage. Okay, treatment over tattoos or permanent makeup. So the reason why we never want to take IPL, I mean, we would never take light-based technologies even close to hair, right? Because we can singe it off. If I get this close to the eyebrow, I could, whoop, okay, we just burn the eyebrow off. So you got to be very careful with that. Now, if it's radio frequency, there is metal in the ink of a tattoo. So I don't know if you've ever seen pictures, if you haven't, Google it, pictures of somebody taking an IPL over a tattoo. It's horrendous. It blisters, it scars most of the time. It destroys the tattoo. You can't even make out what the tattoo was. So it's because of that metal in the ink. it's picking up that light. But the same thing with radiofrequency. Going back to like if somebody has metal implants. So if you're taking it over permanent makeup or any type of metallic pigment, like a tattoo, that's going to heat up as well. So it would create issues like burns, blistering of the skin. You don't want to do that, of course, destroying their tattoo. So you have to be very, very careful with that. And not getting too close to the metallic pigment. So now with radiofrequency, because it's not light-based, let's say my eyebrows were tattooed with metallic pigment. I just would never go right over it. So I could go around it well, but I just couldn't go right over it. Same thing with like the V-form. If I had a big tattoo on my arm, I could just not take that V-form right over the tattoo. I could go right up to it. But with IPL and Nd:YAG, your light-based technologies, light naturally scatters. So because light scatters, if you're too close to it, that metal in the ink is going to pick it up from a distance. So you got to be careful there. So ways of really making sure you're safe. If they have a big tattoo on their back and you're doing IPL hair removal, take gauze, and there's also like white medical tape that you can get. So take white gauze and tape it around the edges with white medical tape so that light will never scatter over into the tattoo. If I had my eyebrows tattooed, I would just keep a distance of 1 finger width. So that's the distance I stay at with any type of tattooed eyebrows or tattooed lips. That 1 finger distance. So be careful with that. Pregnancy. There's usually no reason to go into an explanation with this, right? We just never, ever, 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 ever want to take any type of risks with somebody pregnant. We are putting energy into the body. So, you know, when we do this, we never want to, of course, take a risk. So same thing as they need to avoid anything that could potentially be going into the body or bloodstream, like Botox, filler, and energy-based treatments. You know, unfortunately, they just can't be doing anything when they're pregnant. We have to keep that safety of that fetus growing inside, making sure that we never do anything to that fetus. Okay, next one, blood coagulation, excess bleeding, bruising tendencies. So excess bleeding and bruising due to thin blood. So it's irregular hemostasis. So this is when the patients do not have that normal clotting ability, that normal clotting cascade. So if you're using heat, which in turn stimulates micro blood circulation in the area. If you're using vacuums such as the V-form, where we're really in an ability to create bruising, right? It's a vacuum. I always say, what's going to happen if I sucked on your neck? You're going to hickey. Why? It is working as a vacuum, right? We're breaking blood vessels, tiny little blood vessels when we do that. So if you see bruising, that's what has happened. So because they have this irregular hemostasis and they are so susceptible to not having that normal blood clotting process to repair these blood vessels, they could easily bleed out because they don't have the ability to repair the blood vessels that the vacuum and the heat could potentially create issues too. So you got to be very careful with that. Now that just falls in line with the next one, and that is the use of blood thinning medications. So if they're on any type of prescription blood thinners or over-the-counter blood thinners, there's a lot of over-the-counter blood thinners. There's aspirin. You know, some people are on a baby aspirin a day because they have in their genetics history of heart attacks, history of clotting. They had issues with their heart, that, you know, maybe they had to have some type of surgical procedure, or they have a clot, so they're just monitoring it to make sure that there's no issues. So they have to be on an aspirin every day. They are using NSAIDs. They are on garlic, ginkgo, ginseng, St. John's wort, fish oils. These are all blood thinning medications. So we have to make sure that they're discontinuing the use of them 7 to 14 days prior to the treatment. Most doctors say it's absolutely fine, just a 1 week before pop off. If you want that extra safety though, you can do 2 weeks. Now, if they're on an everyday blood thinner, such as Coumadin, then that's going to be a bigger contraindication, because most likely they're not going to be able to get off. If they're prescribed an everyday Coumadin, they're not going to be able to get off that. So that's where it would become, okay, it's not a realistic expectation for them to get treatments done that are energy-based. Want to make sure that their blood can clot, right? When we create any type of issues with vessels, we want to make sure that the blood's not too thin to create issues, right? So this also falls in line to history of DVT, or deep vein thrombosis. So, you know, when they suffer from clotting in the legs, this is a huge medical issue to them, potential risk, right? So they are most likely on an everyday blood thinner, such as Coumadin. So if they're on something like this, it's already a contraindication, and most likely they are on those blood thinning medications. Additionally, we can never take this energy and vacuum, if you're using a vacuum handpiece, over the DVT, where they could have potential blood clots that could move up, which is not a good thing if those clots move up. So we never want to disturb that. We never want to treat over that, nor do we ever want to treat the patient that has this, because of the contraindications that we spoke about previously. Okay, uncontrolled thyroid disease, or any endocrine disorders such as diabetes or lactating women. So I'll talk about one at a time. First, I'll talk about uncontrolled thyroid disease, hypo or hyper, and then I'll talk about why we want to wait 3 months post-nursing and 6 months post-delivery, and then the next slide is going to go into diabetes. Okay, so when we have issues that involve changes in hormone production, there's going to be a couple different things. One, because of their hormone fluctuation or their issues with their hormone production in general, there's going to be a lack of that homeostasis. So, I can't talk today. Lack of healing in general. So there's going to be a potential of healing issues, but there's also going to be a potential of result issues, when hormone production plays a huge role in seeing results. So that's going to be one. Additionally, because they have that lack of healing, that's going to be a big issue. And I think that will really make sense in the next slide when we talk about diabetes and if someone does have diabetes, either type 1 or type 2, we'll talk about both of them, the lack of the hormone function, therefore the lack of healing that the body has. So and it's uncontrolled thyroid. So if they have it, if they have thyroid that is controlled, what I highly recommend is still talking to their endocrinologist, because they're most likely seeing an endocrinologist, speaking to them on the phone, just like you would talk to somebody with history of cancer. You would speak to them, or I'm sorry, you would speak to their oncologist. So I would speak to their endocrinologist, making sure that they agree with treatments that you may be doing for them, that they agree to this, that it would be the right move for them. And if they do agree and they think that there is no risk involved, that you get a written letter from them, from their endocrinologist, as an extra precaution, right? Now, if it's hormone fluctuation due to they just had a baby, that more falls in line with the results that this huge hormone fluctuation of what women go through while they're pregnant, after they deliver, while they're breastfeeding. You want to wait until those are stable, and that then they could receive treatments to then get the results that they're looking for. So we recommend 3 months post-nursing. If they're not breastfeeding, then it would be 6 months post-delivery, delivering the baby. So a lot of women breastfeed for a year or 2 years. So they just want to wait until they have stopped and wait 3 months past that. Okay, let me see if I missed anything here. All right, diabetes. So there's different types, right? There's type 1 and there's type 2. The good thing is type 1 is going to be a much bigger contraindication because they don't have insulin production. And when they don't have insulin production, that is affecting every organ in the body. It can create death, right, to any organ in the body. So skin as well, because we need insulin, right, to keep our everything alive. So with type 1, though, they're insulin dependent. You know, they're giving themselves injections of insulin to make sure they stay healthy. But there's a huge risk there when you're taking heat into the skin, into the tissue. And the reason being is there's concerns of high and low blood pressure, weakened and very fragile blood vessels. Now think back to what we were talking about, the easy bleeding, bruising tendencies, and what can happen of them not being able to properly heal it and potentially hemorrhaging. Not good. You don't want to get into that situation. Hormonal issues, we spoke about that. Fragile skin, we spoke about that with Accutane. So with diabetes, they have it all under one umbrella. So this is going to create an issue there. Additionally, they're on a wide range of medications, and their wound healing repair process is slow and defective. So we are going in with heat, right? We're creating these little microthermal injuries with radio frequency. We're using high heat with Nd:YAG and IPL. So we have to make sure that their skin can properly heal what we're doing. So that's where it would be, or that's why diabetes is a contraindication. Now, because of, you know, we have a huge percentage of people with diabetes, but because type 1 diabetics is only about 5%, and 95% of diabetics usually fall under type 2. So of course their insulin is also being compromised, but their body is still producing some insulin. So a lot of times with medications or just getting healthy, right? Working out, eating better, sometimes the disease can go away. So with them, that's more, I would say, if you're wanting to treat someone that had type 2 diabetes, but it was controlled, then that's something that you could talk to the medical director of your office and get clearance that they think it's okay to treat. Additionally, you can speak to their endocrinologist and make sure that they think it's okay for you to treat. Just always have that backup. If they're being treated, if they're controlled diabetes, they're most likely seeing a doctor for that control. So if that's the case, always speak to the other physician just to have that extra backup on, you know, if you move forward to treat against a contraindication. Oh, additionally, sorry, I just saw the note and I forgot to talk about it. These patients may take longer to see results and could require more treatments too. So just know that, you know, if you are going to treat type 2 controlled, that that you know that going into like a consultation that it may take them longer, plus require more treatment. Okay, any prior aesthetic or medical surgery affecting the treatment area, such as liposuction, really any, just think of it, any surgery in the area that they're healing. We're gonna wanna wait 3 to 6 months post-surgery. If you wanna be extra safe, wait 6 months. But 3 months at least to allow everything to heal. You know, liposuction, for instance, we want to make sure there's a lot of trauma, right, to the area. We have to give that downtime for all of that tissue to heal, the scar tissue to heal, the sutures to either be removed, or if they're dissolvable, allow the time for the sutures to dissolve before you go in for treatment. So this is going to be the contraindication. If physicians want to treat before that, that is 100% up to their discretion. It is a contraindication from us, from Viora, from FDA, because it's just shown that it, you know, everything needs time for healing. So, so just be very, very careful with that. Okay, so here's something that some of our doctors will do, especially like plastic surgeons, if they have done, you know, liposuction or tummy tuck, something like that. Sometimes they will do lymphatic treatments. So without heat, that can aid in the healing process and reduce edema, swelling, inflammation. Okay, so then I'll talk about that a little bit more, but I'll just keep reading this. When starting radiofrequency treatment, so that's when you're including the heat, not just the vacuum, wait for the hardness under the tissue to resolve. Then they can be treated and will have good skin contractures. So the hardness usually subsides after about 6 weeks. So if you're going in to do something like lymphatics to help with edema, if a plastic surgeon did a neck lift and now the neck is so swollen like a bullfrog that you're able to use the vacuum to push the lymphatics and the edema and allow that inflammation to come down, so it's more comfortable for the patient. It's a quicker healing response. Just no heat, right? And being very careful with the vacuum, being very careful with ever going over any type of like sutures or where the cuts were made during surgery, and just really avoiding all of that. But with heat, you have to be careful too. So very safe, wait 3 months after the surgery. If you want to feel the area, if there's still a hardness to the tissue, you can wait 6 weeks for that to resolve and then go in with the heat-based treatments. I'm trying to think of other examples because I get a lot of questions on this. Trying to think of some other things that I could give you. One thing. This is kind of going off contraindications, but we were talking about using the vacuum with lymphatics after surgery. Sometimes the doctors will do lymphatic massage after surgery, so on and so forth. Also, if you're doing a series of radiofrequency treatments before the surgery takes place, so let's say somebody has a lot of skin laxity in their abdomen because they lost 100, 200 pounds, it's also a good idea to do radiofrequency treatments beforehand to get the integrity of the skin. A lot of times with that kind of laxity, just the integrity lacks. So when you're doing that and you're getting the integrity back, then they go in for surgery. That also really helps them heal faster after surgery, after like a tummy tuck. So additional to not only healing faster, but the results looking much better. Thicker skin, the integrity of the skin is better. That it's just going to just go hand in hand with surgical procedures. I have a couple questions here. Okay, for face, would you recommend the Pristine lymph drainage protocol and neck? Are you referring to like post-surgery?
Yes.
Okay.
Like,
yeah, absolutely, you could. Just making sure that that vacuum isn't very high. And then using the smooth tip, absolutely, just very mild vacuum just to help with any of the swelling post-surgery, sure. Some of our plastic surgeons have used the V-form or the reaction, if you guys own the reaction system, taking the radio frequency off. Very light vacuum 1, and additionally doing some lymphatic massage with that. So the Pristine can be used as well. Just be careful. Very, very mild vacuum. Okay. Patients prone to keloid scars or impaired wound healing. Okay, so I just want to point out somewhere down here, I think. Okay. We are creating a microthermal injury to the tissue, right? So we also know that skin type 4s through 6 are prone to keloid scars, especially skin type 6. Ways of knowing, you can ask them, have they ever had an injury and they have a raised scar? So you can look at it. Is it a hypertrophic keloid scar? When they got their ears pierced, is there any type of raised scarring in the area? So these are questions that you can ask. Because radiofrequency or IPL or NDIAG, they're all heat-based treatments, because we are doing deep tissue heating, right? Deep tissue bulk heating, and we're creating that microthermal injury. These patients are known to have a wound healing impairment, and results may vary, but also if you created any type of like arc on the skin, they could potentially keloid scar if they're susceptible to it. So again, if you're going to go off of this contraindication, just make sure that your medical director is okay with this. Make sure that the patient knows that this is a big risk, because we are using heat, right? And it could potentially happen. If you are going to do this, if the patient's going to take the risk, if the medical director says, okay, test small areas and make sure that they're safe and that there's no potential risk. Or, I mean, there is a potential risk, but that you're reducing that potential risk. Okay. So this, I was more so referring to just in general, because I sometimes get the pushback of, well, yeah, but all skin type 6s are prone to keloid scars. So if they're prone, then we can't treat anybody of a skin color above a 4. So, that's not always the case. It's just, we know there's a risk there. But again, ask them, did they cut themselves and there is a scar there, their ears pierced, and look at it. If it's a hypertrophic keloid scar, then that's going to be a contraindication, right? Then you want to be careful and avoid treating them. But if it's someone of skin type 4, 5, and 6, then they may have a scar, but it's not hypertrophic. Maybe it's a bit raised, but it's not that hypertrophic keloid scar. Then just take those extra precautions and treat small areas, making sure that you're safe. Okay, use of drugs that influence the immune system and impaired immune system, such as HIV. So really quick, I want to talk about lupus, because lupus falls into this as well, right? I would avoid treating lupus patients. They can have terrible flare-ups. butterfly rashes, just flare-ups within the body. So you have to be very, very careful with that. If you are going to treat somebody with lupus, they need to know that there is a risk, and your medical director needs to say it's okay. Additionally, I would speak to their treating physician and making sure that you're getting advice from them. So be very careful with that, because we've seen many flare-ups happen with these heat-based treatments. It's not fun. So that is a contraindication. If they have something like HIV, right, and they're on drugs that influence the immune system, so they're going to be on immune system drugs that, because with HIV, the immune system is attacking the body. So they have to be on medications that then suppress. And that is where the issue is. The immune system is going to, we're going to need it to be functioning very properly to use any type of heat-based treatments to the body. And because they're on drugs that suppress the immune system, this is where it's a big contraindication. If something happens with the heat and you create a burn or an arc, which can happen, right? It's always a risk when you're using these technologies. They can easily lead to infection. So that is where it's going to be a big contraindication. So again, if you're going to treat anyways, all of the same things I said, making sure the medical director has said okay, making sure their treating physician has said okay. The patient needs to know it is a huge risk to them. And most of the time you don't want to take that risk on because it is a contraindication. But if you do, all the things that I'm advising you on, because they do not have that normal healing response, because of the immune disease they have, plus the drugs that they're on. Two bad things for treatment. Hepatitis or liver disease. Okay, big contraindication here. With liver damage, they can have a lot of weight loss. They are so susceptible to easy bruising and bleeding tendencies, and fragile blood vessels. So again, that potential of hemorrhaging, never want to get into that scenario. A lot of edema, and additionally just they don't have that proper healing response. And that is so important when we're using these heat-based treatments, is that they do have that healing response within them. Okay. Sorry, I just was wanting to point something out, because these patients have a suppressed immune response, right? And immune deficiencies. So before we move on, I'm going to talk about the additional contraindications that more so apply to like the everyday things we're doing, like filler and Botox and peels and retinols. So before I get into that, do you guys have any questions on what we've gone through? I feel like I can't.
Kara?
Yes.
Hi. How would you counter if they do keloid? So what would you do to reverse it, or how is it reversible if they don't know they keloid?
Oh no, a lot of times no, because the problem is if they keloid scar, it's not like you can go in and with heat, because that's what created it in the first place. So it could become even worse. So unless you're going to do like a surgical procedure on them and remove the keloid scar, even then it's a risk that they can keloid again. So so no, it's not something that is going to be reversible, because there's always a chance of keloid scarring with anything you do, with microneedling, with heat-based treatments, with scar revision even. And I of course don't want to make this a scary webinar, right? Because all the other webinars, it's like, oh, the fun things that we can do. But I want you guys to know these risks, and I never want you guys to get into any of these scenarios, right? Lawsuits can happen. You never want anything to happen to your patient just because, you know, you don't want anything to happen to them. So not to, you know, fully scare you guys, but at the same time, there are risks to these patients, and I never want that to happen to you guys. So I want to give you all of the precautions and making sure that you thoroughly go through their consent forms. Because I've gone to some offices where they don't even have them sign a consent form, so they don't even know if there's these potential risks. And you know, some of these things can be very problematic. I've gone into offices where they do consent forms, but they never look over them. You know, that is of course problematic. So just making sure that you have them filling out these consent forms. We have the consent forms on the customer portal, Viora's customer portal, and there are samples. So these are contraindications that you can then take and create your own consent forms and add additional contraindications, or not even contraindications, but additional things if you'd like to be even more cautious within your office. So making sure that you really know your consent forms, you know how to sit down and really go through them with the patient. If there's medications that you're unsure of, that you know, chat with the medical director to make sure it is safe for them. If you still are unsure, reaching out to clinical and asking us so we can give you that feedback and making sure it is safe for these treatments. So we just want you guys to be safe, and we don't want anything to happen to your patients and or you as an office. Okay. So now we'll go into synthetic fillers. So silicone, that's probably our most common, right? Now, synthetic fillers are really not as popular nowadays, right? Like back in the 1990s, sure, they were. A lot of people were putting silicone in their face. But it's more so natural fillers that are being injected nowadays. However, if you do have a patient with silicone, or any type of synthetic filler. Additionally, PDO threads, because those are popular for sure. PDO thread lifts, where they put the threads in the face. Those are not heat resistant. Neither is silicone. So because they're not very heat resistant whatsoever, even though with radiofrequency, we're using relatively low heat, 39 to 42 degrees Celsius, with the IPL, we're getting up to much higher heats for sure, typically about 60 to 70 degrees Celsius, and in DIAG as well. We just don't want to take these handpieces over anything that's synthetic ever. So that's just, they just can't have the treatments done if they have silicone in the face. The heat can't go over that. PDO threads, we need to wait until the threads have dissolved. Otherwise, the radiofrequency will dissolve them. So if you guys do thread lifts, just check in, because I used to say it's about 6 weeks and then it's safe to treat. However, that's not always the case. So I would just check with your manufacturer of the threads and ask them, how long do your threads take to dissolve in the skin? Then you know when it's safe to go in with heat-based treatments, because it may vary and you just want to be extra safe with that. We'll talk about natural fillers too in just a moment. Okay, patients who have received Botox. So we could treat after 4 to 7 days. I just say wait a week. Especially, we don't want to go in with pressure with the ST handpiece or the IPL handpiece and using pressure on the area and potentially with heat and the pressure moving it around, and now they have a droopy lid. So I would just be very careful and wait just the full week. Studies show it is safe to do Botox after 2 to 4 days. Again, I'm bigger on the safety side. What's a week? It's nothing. They can wait a week for treatments, right? However, it takes 4 to 7 days to fully activate, right? If you guys do Botox, or if you've had Botox done, after you get your injections, 4 days later, and you're in the mirror and you're trying to see if it's working, it still hasn't taken its full effect until about a week after. So some physicians wait at least a week, again, safety, and maybe even 2 weeks. If done sooner than 2 to 4 days, there's a chance of heating the Botox with possibilities of spreading the toxin to unwanted areas. Again, we don't want a droopy lid. So I just wait a week just for safety. Okay, patients who have undergone chemical peels. Now, if they are lighter chemical peels like glycolic, sometimes salicylic, Jesner peel is probably the most common. These are, it's not like true downtime. It's not like a peel that's removing all of the epidermis, so they have a true downtime. More just, kind of peely, snaky skin. We want to wait 2 weeks before treatment. And that is the same for any natural fillers. So anything that the body reabsorbs naturally. So your hyaluronic acid type fillers, which are your most common, like, oh my God, I just forgot, like all Restylane and Juvederm, and I used to be able to just list off all of those fillers. I haven't done a training in so long that I'm forgetting names, but you guys know what I mean. Things like Juvederm and Restylane, where the body just naturally reabsorbs it. It's safe to go over the area 2 weeks after. Those type of fillers are very heat resistant to much, much higher heats. So you just want to wait 2 weeks though. And then additionally, those lighter peels like a Jesner. Okay, just want to make sure I didn't miss anything there. I'll talk about the irritant topical agents in just a bit because we have a slide on that actually. Okay, now we're getting into the deep chemical peels and the ablative laser treatments. When they have like a full CO2 or a full erbium YAG, when they're really removing the full epidermis and it's no longer social downtime, it's true downtime. Dr. Obagi does a peel called a blue peel, same thing, true downtime. Where it's done in a medical surgical type setting. Phenol, same thing. So these type of very deep peels like phenol, like blue peel, like CO2, erbium YAG, true downtime, we need to wait at least 3 months up to 6 months because that is true healing. It's like a surgery, right? They have to fully go through that healing process. It's typically 3 to 4 months, but can be upwards of 6 months. So just be very, very careful on them that you are not treating them too soon because their skin is still very much healing. Okay, here's the irritant topical agents. So things like retinol, tretinoid, Retin-A, they have salicylic in their face wash. They have glycolic in their toner that they use at home. They want to discontinue that 2 to 3 days prior to treatment. Now, if they were on a strong retinol and their skin was truly peeling from it, treat that more like a peel. Wait 2 weeks. Be careful with that. But if it's just, light retinol, if they have bad acne and they're on a strong tretinoid, that that's going to create quite a bit of peeling and sensitivity to the skin. That's when I would wait 2 weeks. But if it's something like, you know, they're just using salicylic in their face wash, they're using a very light retin-A just for skin cell turnover, but they're not sloughing off, just have them discontinue that 2 to 3 days prior. I just want to note this, some patients will lie to you. If that's the case, if you start, let's just say with the ST handpiece, you start working around their eyes or wherever you're treating, and it turns very red and they are very uncomfortable, even at a low setting, I would then just ask them, quiz them, what are you using at home? Have them bring the products in. You know, this is not a normal response. Stop the treatment and just make sure, you know, next time you come in, bring in the products that you're using so I can take a look at it, make sure it's not making your skin too sensitive for the treatments. If it is, we'll have you pop off 3 days before you come in for your next treatment. So 48 hours is allowed, but most physicians recommend 72. So again, I always push towards the safety, so 3 days. Okay, so now we'll go, before we go into additional contraindications for light-based treatments, do you guys have any questions so far? I feel like I can't talk today. I don't know why. I feel like my flow isn't there. Forgetting words. All right. Cynthia lives here in Vegas as well as I do, and she said it's the Vegas heat. I don't know what it is today. Maybe I didn't sleep well last night. Okay, so no questions. So let me switch my shared screen, and I'm going to show you guys a couple things here. So first I'm gonna, if I can find it. Oh, it's all in here. Let's see here. Okay, so I'm gonna pull up the IPL contraindications. And we'll view, oh, you know what? I think I need to, hold on, I think I'm doing this wrong. I think I need to stop this share. Oh, maybe I don't. Okay, let me see if this works. It looks like it's working on my end. So just let me know if you can't see the IPL contraindications. All right, let's, uh-oh, it's not letting me move. Oh, there we go. Okay. Oh my gosh, that's so tiny, you guys. I'm so sorry. I'll just use it as kind of like a reference so I don't forget to tell you guys anything. So these first few are all the same, right? Cardiac pacemaker, metal in the treatment area, pregnancy, the use of drugs that suppress the immune system, HIV, lupus, history of bleeding, bruising tendencies, blood thinners, DVT, deep vein thrombosis, history of cancer, I don't know if I just said that, hormonal disorders, all the same. It's not letting me flip pages. Come on. Why did it work just a second ago? Oh, there we go. Any history of disease which may be stimulated by high heat. With IPL, we're using high heat. Here's an additional one that's not going to be for radiofrequency, but it is for light-based treatments, and that's epilepsy. You guys have had an IPL treatment, you know. You put blackout goggles on a patient, and they can still see that very, very bright light. Usually that's what scares them the most when they're having these treatments done for the first time, because it's like, it's startling, that bright light. It's like, wait, I can't see anything, but this bright light I can see. So you can imagine with epilepsy that can absolutely stimulate an epileptic seizure. Do not want that to happen. So, no, anybody that is epileptic, no light-based treatments. Suffering from keloid scars, same thing, impaired wound healing. Next one is vitiligo. So vitiligo, or the tendency to hypopigment. So with vitiligo is a condition, a skin condition where the melanocytes in the area stop producing pigment. So they have white patches of skin. Sure, you guys have seen people with vitiligo. For some reason, I think it's just the most beautiful thing. I just love it. But it's that mix of dark pigment and no pigment in the area. So with light-based treatments, because their melanocytes already have the potential of not producing pigment, we, with the IPL and with the Indiag, are treating melanocytes, right? It is targeting melanocytes. So that's why it's a big contraindication, because it can hypopigment in that area, right? Because their melanocytes are not functioning properly, right? So we just need to avoid that. Okay, fragile, extra dry and sensitive skin. We know that. History of skin infections and herpes. Accutane, same thing. With Accutane, it says wait at least 3 to 6 months. I would be very careful with Accutane and wait the full 6 months. Tretinoid, Retin A, same thing. 2 weeks though. With IPL, the IPL can be a lot more aggressive on somebody with dry skin, and that's what tretinoid or Retin A, retinols are doing. So 2 weeks, you'll have them pop off 2 weeks beforehand. And I'm sure you guys know, if you have experience with the IPL, you know how, if somebody has dry sensitive skin, how the IPL can respond in an aggressive negative way. So just have them pop off 2 weeks beforehand. Sunburn in the treatment area, or exposure to sun in general. This is a huge one. I cannot express this enough. Or artificial tanning, which I'm so happy because Las Vegas finally is opening back up, and I was able to get a spray tan yesterday. So I feel like, I just feel more healthy. So a lot of us women love spray tans. And a lot of women love the sun. So you have to be very careful. And the contraindication is 3 to 4 weeks prior to the treatment. Absolutely with sun, I would be very careful and just say 4 weeks. If they went on a cruise, they went to the beach, they went out to the lake for Memorial Day weekend, and they were out there for 3 days and they have a suntan or a sunburn, wait the full 4 weeks. You want to be safe because their melanocytes are so active at that point that they are so susceptible to an IPL burn. So I wait 4 weeks. Now, artificial tanning, like a spray tan, or artificial tanning like a tanning bed, wait 4 weeks. But like a spray tan, I wish my spray tan lasted 3 to 4 weeks. It does not. At the most 2 weeks, and that's pushing it. So that you can treat sooner. So usually spray tans are gone in about a week, depending on like how many times they're taking showers and if they're using loofahs to scrub. So if you want to be safe, just say 2 weeks. But usually spray tan's gone in about 7 days. And if they have a little residual spray in the area, just very minor. It's at like the 7th day. It's not the best because you don't want to use alcohol on the skin before a treatment because it dries it out. You don't want it to be dry. But if need be, you know, they're getting their underarms for hair removal and oops, I did a spray tan 7 days ago. Take a piece of gauze and some alcohol and just remove that residual spray tan with alcohol. But if it was like, oops, I spray tan 2 days ago, then you would have to scrub for a very long time with alcohol to get the rest of that off. Therefore, their skin's going to be way too sensitive to have the treatment done anyways. So if you want to be safe, 2 weeks. Okay, same thing with childbirth. I don't know why this is giving me issues with flipping pages. Okay, use of photosensitive medications or herbs. Okay, so when our IPL first came out, I had the question of which medications are photosensitive. So I was like, you know what? I'm going to make a list for people so they have that to reference. And I was making columns of photosensitive medications. And I was on, I think, like the 2nd page, and I finally gave up. There's too many. So what I just highly recommend is they should, and usually the pharmacist puts a sticker on the bottle saying this medication is photosensitive. So if they're on a lot of medications, have them bring them in at their consultation so you can take a look at their bottle, see if it says photosensitive. Talk to your medical director. Is this medication photosensitive? If you guys don't know, you can always look it up. If you still don't know, you can call their pharmacist. If you still don't know, you can email us and we'll look into it. So if they are on a photosensitive medication or herb, they need to get off 2 weeks prior to the treatment for safety. If they can't get off of it, then that's going to be a contraindication. And if you're still going to treat, that's going to be, again, just something that your medical director would have to say it's okay and take it upon themselves because it is contraindication. Okay, so herpes, we spoke about that. Tattoos, we spoke about that. Moles, we spoke about that. Synthetic fillers, Botox, all right, same. Chemical peels, same. Patient should wait at least 3 to 6 months after a chemical peel, same. Okay, so that is the additional ones for the IPL and NDIAG. So I'm going to show you guys one other thing. Let's see, I need to get to, no, not that. Oh, you know what? I think I have an issue with this. Okay, so now I think I need to exit out of here. Perfect, got it. Oh, I figured everything out. Oh, you know what? I do need to mention a couple NDIAG contraindications. I forgot about that. Because of leg veins, because you're treating for leg veins, if you guys do have the NDIAG. So let me just point out, I don't want to forget any, so let me just point out a couple of the additional ones for YAG. These are all the same, everything we went through. Epilepsy, same. This is so small, you guys, I can barely see it. I have glasses, I don't wear contacts, but I have glasses that I sometimes need. So I should get those when I'm doing these tiny little, oh goodness. These are all the same. Oh, here it is. Gosh, I can barely see that. No, that's Botox, that's the same. You know what? Let me see if I can find something else that you guys could see better and I could see better. I'm just going to stop sharing just for a second. Just give me 1 minute here to find something. Uh-oh, why won't it let me? There we go. Okay. It's funny learning how to navigate your computer while you're on Zoom. It's been fun. It's been a learning process. There we go. Okay, just had to find something really quick for you guys. So let me get back into the full screen. Oof, I don't want you guys to see my nails. They're horrible. I've been playing tennis a lot. Trying to do anything to like exercise, keep my mind off of all the craziness that's going on in the world, and started playing tennis again, and man, it has like ripped my nails off. I guess I've been playing kind of aggressively. I used to play competitively. I mean, I wasn't all that great, but finally getting back into it. All right, so I'm going to share this here. All right, maybe you can see that a bit better. And here is, you guys, here's our consent forms from Viora. So like I was saying, you guys can take this and then customize it, right? You would put your logo at the top, add additional contraindications that you feel are relevant to your office. But we do put it's a demo consent. So you guys will have to make it your own in your office, but we give you this as a starting point for sure. And just make sure when they're doing these consent forms, everything's filled out. That's so important. You know, some people are kind of quick at doing these, and it's not filled out in its entirety. It's a problem. So just make sure you really take your time with them at the consultation, going through all of these details. If something is not checked off, make sure you ask them about it. All right. Oh my gosh, why is it doing this? Let me flip. Okay, here's something I wanted to point out to you guys too. A lot of people miss this at the top. So if you're using our consent form but still making it your own, it would be I. So if I were to be getting my treatment done by you, I, Kara Moncrief, authorize Cynthia and her last name, Giovanna and her last name, and that you, the operator, are authorized to do this treatment on them. So just make sure they don't forget that part if you are kind of copying our consent form. And then client's name, signature, and date, and then treating the treating person, Cynthia, Giovanna, whoever it is, name, signature, and date. You guys can additionally, if you'd like, add the medical director at the bottom of there, and that the medical director also signs off on all of the consent forms, just, you know, as a precaution. So you guys just, you know, make it your own. Oh gosh, I thought it was on here. No, I guess not. So I was just thinking about, like, if you were doing leg veins, and I guess it's not it wouldn't be on the consent form because it's not a contraindication. So I don't know why I was thinking that, but it's more of the post-care guidelines, which we went through last week, and it was more of the you know, not flying or driving for those periods of time to not risk any blood clotting. But it's not a contraindication, it's just post-care guideline. So I don't need to go through that, but I just wanted to also show you guys the consent form. And these are found on myviora.com. If you're from international, if you're overseas and you do not have these consent forms, you can absolutely get them from Viora, from your distributor. If you are the distributor overseas, then you can get them from Viora. If you are an office in the States, then you can find them on the customer portal, and then make it your own, of course. So let me show you guys one more, and then I'll take any questions you guys have. And then I think we're pretty much done. Okay, so what do? I exit here, and then I go to here. Oh, if you guys have the VFR, so I sometimes forget this isn't just for the US, right? It's for all of Viora, so overseas. So you guys have the VFR. So in the States, it's still, you know, and it's still not FDA approved. We're still in the case studies. So just make sure there are some additional contraindications for the VFR. Where there's a longer waiting period, because the VFR, because we have the ability to get into ablative temperatures over 100 degrees Celsius, that's when it would be a longer wait for Botox, a longer wait for filler, because we get into extreme high temperatures. So just make sure that you're reviewing that, and you know why. And it's because of why I just told you, because the temperatures are much, much higher to where we can start affecting these things like filler. So there's going to be a longer waiting period. If you guys are in the study in the US, you know that patients cannot be doing Botox or filler anyways, because it's a requirement. So just make sure that you're really paying attention to those consent forms when you're doing, if you're part of the study. And then overseas, you know, this is why, because we're reaching higher temperatures, and why we need a longer waiting period for VFR. Other than that, it's radio frequency. So it's, you know, the same contraindications. So I just wanted to show you guys one more, the V form. We have consent forms for everything. So I just wanted to point that out to you guys. When you go into the customer portal, there'll be a consent form for V form. There'll be a separate one for VST. Make sure they are filling out this, because this happens where, you know, something potentially happened to the patient because there was a contraindication. And you guys will reach out to us at Viora, at the clinical department, and I'll always do a patient review if something happens. I'll ask for their before and after photos. I'll ask for their consent form to make sure there were no contraindications. We will ask for their chart to make sure you were doing the proper treatment. And this has happened to where they send in the consent form and it wasn't the consent form for the treatment that they were doing. They were doing IPL and they had them fill out a V form consent. That's not good. That's not good from a legal standpoint. That's not good for you from a medical standpoint, because there's additional contraindications with the IPL. So same thing with the ST and the V form. Make sure that they are filling out the proper consent form for the treatment that you're doing. Anyways, I just wanted to point that out, that we have them for all hand pieces, all technologies, and that's going to be important. Okay, so I'm going to stop the share. Okay, now any questions that you guys have, now that we covered it all? I'll just wait a minute. Thank you. This was very informative. Oh, good. Good. I know sometimes people have a lot of questions on contraindications of, why the offices want to understand, why is this a contraindication? And it's important for you guys to know, of course, because we want your patients to stay safe. We do not want you to ever get into a legal issue. But more importantly, it's your patient's safety. And it is important for you guys to know why. So I'm glad that this helped. I have been so appreciative for you and Viora doing this during this time. Thank you so much. You have no idea how good that is to hear. And what's so nice. I love that you guys join live, even though it's recorded, because you know your questions are always so important and your feedback is always so important. But I think additionally, because these are recorded, you can go back and watch. You know, it took me months, if not years, to understand the skin and technology so well. And even now I'm learning, you know, and we're always learning. So because even, especially if you're a new operator, because everything is quite overwhelming, because there's so many technologies we have, there's so much we can do, there's so much we can combine, there's contraindications that we have to be careful with our patients and not treating them if they can't be treated. And there's so much to learn and remember. So I think with these being recorded, you can go back and watch them anytime you need to. If something happens where a patient may check off that they have a contraindication and you're like, oh shoot, I don't really remember why this is a contraindication, but I need to talk to them about it and explain what's happening within their body and their skin. You know, maybe they have impaired immune or impaired wound healing, and you have to understand to explain to them that you need to make sure that their skin is healing properly when you're using this kind of heat. And if they have the impaired wound healing within their body, you wouldn't want to take that risk and create an issue with their skin. And then they are appreciative of, okay, thank you. I want to be safe, of course, as well. But here's what we can do, you know, outside of the technologies, you know, facials and things like that. You know, you can still keep their skin, you know, at its best integrity that it can be, even if you're not using these technologies. There's still outside things that you can offer them. And I'm sure they're just going to be appreciative. You're going to get some patients that are going to want to fight you on it for sure, because they want it so bad. Their best friend had it and they look amazing and they're like, I want it. You know, there will be times that they'll fight you on it, but you know, their safety first, and your license first, and your business first. Okay. Excellent job, Kara. Thank you. Rewatching. I've learned more every time. It's true, because our brains do not absorb 100% the first time we hear it. So when you keep watching, you know, you keep absorbing more and more and more. So I'm so glad we recorded them and that they're available for you guys in that way. Yes, I am a new operator and I'm loving and appreciating the videos. V20 arrives Monday. Oh my gosh, how exciting, Jessica. Congratulations. I'm so excited for you. And I think what a perfect time this was, that you could watch these webinars, already get a good understanding of the technologies before they arrive, before your trainer gets to you. It'll just make it that much easier. Your whole learning experience will be that much easier. So excited you were able to join, and welcome to the Viora family. Thank you for joining. Thank you for being excited for Viora and everything that you have to offer your patients. I'm sure they'll feel that. They always do. They always feel your excitement and your love for the industry. Hi. Wait, I'm going to unmute you. Hi, Jessica.
Meet you. I talked to you like last week, but I just want to say thank you. And say
oh my gosh, I remember. But thank you so much, and I'm so excited for you. And just welcome to the Viora family.
Thank you so much. I appreciate it.
And it's so nice to see you. It's so different than on the phone, right?
It is.
Okay, you guys. Well, if you do not have any additional questions, I think we will sign off. Hour and a half. I did not think it was going to be that long. I always say that, you guys. I didn't think it was going to be that long. But good. I'm glad it was helpful. Next week on Friday, I'm really excited about this one. Heather is going to be joining me, one of my clinical trainers. It is going to be a longer one for sure, but it will be on Friday, and it's Skin 101. So we're going to talk about all the layers of the skin, what each layer houses, you know, what's in the fat layer, what is in the hypodermis, what is in the reticular dermis, what is in the papillary dermis, how are these technologies working in the skin. I'm so excited for that one because I feel like most of us always need this in the beginning, and then your brain connects to everything that these technologies do. Oh, this is why I choose the IPL for this patient. Oh, this is why I need to use the ST and the IPL for this patient to give them what they're wanting and needing. So I'm excited for that one. Not tomorrow. Oh, next Friday. All right, you guys, have a great weekend. I will see you next week, and stay safe.
Thank you. Bye.
Thank you guys. Bye.